শনিবার মানেই পূর্বাচল ভ্যালি যোগ সূত্র আর সেই অনুষ্ঠান নিয়ে আমি আপনাদের সাথে যুক্ত হচ্ছি। আমার নাম তাইব অনন্ত। আমাদের আজকের বিষয় হাইপারটেনশন। এই হাইপারটেনশন নিয়ে কথা বলতে আমাদের সাথে আজকে উপস্থিত আছেন খুবই বিশেষ একজন ব্যক্তি। তিনি ডক্টর টম ফ্রিডেন, প্রেসিডেন্ট অ্যান্ড সিইও রিজলভ টু সেভ লাইভস। আমরা তার সাথে কথা বলবো হাইপারটেনশন বিষয়ে। Sir, welcome to our show. How are you?
Great to be with you and look forward to our conversation.
So it's great to have you in our studio. Sir, let's start with hypertension. What is hypertension?
Hypertension is an elevated blood pressure. High blood pressure is something that is very dangerous for your brain, your heart, and your kidneys. And 1 in 4 adults in Bangladesh has it, but only about 1 in 10 of those who have it adequately controlled. Let me put it another way. High blood pressure today is the leading killer in Bangladesh. Now, Bangladesh has made tremendous progress reducing deaths of mothers and infants, reducing malaria and tuberculosis, preventing the spread of HIV. And because of that, life expectancy is way up in Bangladesh. But what that means is that the challenges are new and different. And right now, the #1 challenge, the #1 killer is high blood pressure, also called hypertension.
আমরা ডক্টর টম ফ্রিডেনের সাথে কথা বলছি। আমি একটু ওনার পরিচয়টা আপনাদেরকে জানাতে চাবো। হি ইজ দ্য প্রেসিডেন্ট অ্যান্ড সিইও অফ যেটা বলছিলাম রিজলভ টু সেভ লাইভস, আর নট ফর প্রফিট organization partnering with countries, communities and organizations to prevent 100 million deaths from cardiovascular disease and make the world safer from epidemics. Sir, I think the viewers would like to know about you as well, so would you like to introduce yourself?
Thank you. Taeeb, it's great to speak with you. I'm a physician. I have training in internal medicine, infectious diseases, public health, and epidemiology. For more than a decade, I worked on tuberculosis control, including here in South Asia. After that, I became commissioner of the New York City Health Department for 8 years under Mayor Mike Bloomberg. And after that, I was director of the U.S. Centers for Disease Control and Prevention under President Obama, also for 8 years. At the end of the Obama administration, I left that position and started this organization, Resolve to Save Lives, focusing on 2 of the leading killers in the world with the goal of partnering with countries to make the world a safer and a healthier place.
Oh, beautiful, sir. So before the show, when we are talking, you said you just came from Rwanda, and I get to know as well that you've been to India for 5 years. So over those countries, are you working on hypertension as well?
In our organization, we work on several broad things. One of them is cardiovascular health, that's preventing heart attacks and strokes. Another is preventing epidemics and improving the public health capacity to find, stop, and prevent health threats. We're also looking increasingly at primary health care, because primary health care is where all of these things come together. Will a patient be diagnosed and treated for high blood pressure? Will an outbreak be recognized if it occurs? And this is some of the things that we've been looking at. We're very grateful that we have partnerships in more than 50 countries around the world. And it's an opportunity to identify where we can improve health the most and how that can be done.
All right. To your organization, you said you have connected with more than 50 countries. Can you name some of those countries?
Sure. So we have various different programs. Our epidemic prevention program is primarily in Africa, although also in some of the Middle East and in some other countries. In that program, we have offices in Nigeria and in Ethiopia, and we have activities through staff or partnerships or consultants in the Democratic Republic of Congo and Uganda. Those 4 countries account for a large proportion of the population of Africa. We're just starting a project in Rwanda now, which is why I'm just coming from there, looking at primary care and how it can reach more people and have a bigger impact.
How was your experience in India?
So I was in India for 5 years, from 1996 to 2002, working on tuberculosis control. And I really was able to learn a great deal from the culture, from the community, and from the work on tuberculosis. Tuberculosis is a very important disease to control. It remains one of the top 10 killers, but if you do a good job, you can cure virtually every patient. What it requires is a system of accountability. So the society holds itself accountable for successfully treating every person with the disease.
Let's get back to hypertension. The ratio you have said here in Bangladesh, I'm afraid that do I have hypertension or not? So we would like to know more about this thing. So, sir, would you elaborate?
Sure. Let's start with a very important myth or misconception. There's no way for you to know if you have hypertension without having your blood pressure taken.
All right.
All over the world, people say, well, I don't feel bad, so my pressure must be fine. Mm-hmm. Unfortunately, the first symptom of high blood pressure could be a devastating stroke or heart attack. People with high blood pressure don't know they have it. That's why it's called the silent killer. High blood pressure affects about 1 in 4 adults. It increases with age. The good news is that it's treatable with low-cost, safe, effective medications.
All right. যেটা বলছিলেন টম ফ্রিডেন যে হাই ব্লাড প্রেশার বাংলাদেশের 1/4 যারা এভারেজ বড় মানুষ রয়েছেন পরিণত তাদের ক্ষেত্রে এটা ঘটে থাকে এবং সেটাকে খুব লো কস্টের মাধ্যমেই মিনিমাইজ করা যায়। সেটা কিভাবে করা যায় সেটাই আমরা জেনে নেব ডক্টর টম ফ্রিডেনের কাছ থেকে। Frieden, why is hypertension control important? That's my first question. Along with that, what is its burden across the globe and in Bangladesh as well?
So hypertension is important because it is the world's leading killer. Around the world, it kills more than 1 crore, more than 10 million people each and every year.
God.
That's one person every 2 seconds. So just in the time that we've been speaking, hundreds and hundreds of people have died from it. Most of those people are in lower income countries, and a large proportion are younger. Sometimes people have another myth or misconception, which is that, oh, it's only old people. But first off, we care about old people. And second, it's not only old people. It's also people in their 30s and 40s and 50s who have hypertension and can have strokes or heart attacks or can die from it.
যেটা বলছিলেন টম ফ্রিডেন যে শুধুমাত্র বয়স্ক মানুষদের ক্ষেত্রেই না হাইপারটেনশন এটা হাই ব্লাড প্রেশার থেকে হয় এবং সেটা 30, 40, 50 বছরের পূর্ণবয়স্ক মানুষদের ক্ষেত্রেও হয়ে থাকতে পারে এবং এটাকে আসলে সহজভাবে নেবার কোনোই সুযোগ নেই। যেটা রেশিও তিনি এরই মধ্যে উল্লেখ করেছেন যে বাংলাদেশে অনেক বেশি। আমরা ডক্টর ফ্রিডেনের কাছে আরও কিছু কোয়েশ্চেন আমার রয়েছে, আমি একটু পরের কোয়েশ্চেনগুলোতে যাব। তার আগে একটু ওনার সম্পর্কে আরও একটু বিস্তারিত আপনাদের জানাতে চাই যে ডক্টর ফ্রিডেন ইজ এ ন্যাশনাল অ্যান্ড গ্লোবাল লিডার হু হ্যাজ স্পেন্ট ওভার দ্য past 25 years working to improve health in the United States, যেটা তিনি উল্লেখ করেছেন এরই মধ্যে, and around the world. He is one of the world's top experts in prevention of cardiovascular disease, tobacco control, tuberculosis, and health policy and administration. So you have already mentioned tuberculosis. Just want to know about the tobacco control because we have a lot of people who's consuming tobacco every day. You know.
Yeah, tobacco is. If you look at any single cause of death, not what kills people, hypertension kills people, but a cause, an underlying risk factor, tobacco is number 1. And although Bangladesh has made some progress, still the rate of smoking is very high, especially among men, not just smoking, but also using other forms of tobacco. The most important thing a smoker can do, or someone who uses tobacco can do for their health, is to quit. It's very important. The government can do a lot to support people so they don't smoke, to make it so kids are less likely to grow up smoking. And you know, Taeeb, this is a very important concept. We think about personal responsibility, but there's also government and societal responsibility, and they go together. It's not one or the other. If government, for example, raises the tax on tobacco, fewer kids will smoke and more adults will quit. At the same time, if you are yourself using tobacco, your kid is more likely to smoke and be condemned to the health problems from that. So if you won't quit for yourself, quit for your family.
That's right. আমরা ডক্টর ফ্রিডেনের কাছ থেকে জানছিলাম যে টোবাকো কনজিউমিং এর ক্ষেত্রে কি কি সমস্যা হতে পারে, যেটা বলছিলেন যে গভর্নমেন্টের সরকারের এই ক্ষেত্রে একটা বড় ভূমিকা পালন করতে হবে এবং পরিবারের যারা পূর্ণবয়স্ক রয়েছেন বা যারা পরিবার চালাচ্ছেন তারা যদি টোবাকো কনজিউম করেন সেক্ষেত্রে ছোটদের যারা বড় হচ্ছেন তাদের টোবাকো কনজিউমিংয়ের হারটাও বেড়ে যেতে পারে। আমি একটু জেনে নিতে চাই যে টোবাকো কনজিউমিং যদি করতে না চায়, কেউ কুইট করতে চায় কেউ, সেক্ষেত্রে আসলে কি প্রসেসটা হতে পারে? স্যার, can you suggest us how to quit tobacco? What would be the process?
So first off, to understand that it's not always easy to quit. It's important to think of what you've tried to do before to quit, what didn't work, to set a date certain and decide on that date you're going to quit. On that date certain, you get rid of everything that has to do with tobacco, whether it's an ashtray or other equipment. So
you have to throw it out, or
get rid of it all. And also think about where and when you smoke or use tobacco and avoid those places for a while. There are also medicines that can be used, like patch or gum, that can help. And getting advice from friends and healthcare providers can be helpful as well. Most people who've ever smoked have already quit. And if you smoke, you can quit too.
Oh, beautiful, sir. But still, it's not easy, isn't it?
Not easy, because the tobacco companies make sure there's enough nicotine in the product to keep people addicted. It's an addictive substance. And breaking an addiction is hard, but people are strong and we can do it.
Yeah, and if someone wants to quit, but does he need to avoid all those people who's still consuming?
Well, the concern is if you go to where you usually use tobacco and everyone around you is using tobacco,
that's right,
you're likely to start using tobacco again. So if you really want to succeed, for some period of time, you want to avoid whatever situation it is that you are habitually smoking, because it's a habit as well as an addiction.
আমাদের অতিথি যেটা বলছিলেন যে যদি টোবাকো কনজিউমিং বন্ধ করতে হয়, কনজিউম করা বন্ধ করতে হয়, সেক্ষেত্রে একটা নির্দিষ্ট ডেট রেখে যে আমি আজকাল পরশু অথবা 5 দিন পর থেকে টোবাকো কনজিউমিং করা বন্ধ করব, ধূমপান ছেড়ে দেবো এবং সেক্ষেত্রে ধূমপান সম্পর্কিত যে জিনিসগুলো আমার কাছে রয়েছে সব কিছু থেকে পরিত্রাণ লাগবে, সব কিছু সরিয়ে ফেলতে হবে এবং যেই জায়গায় গেলে যেখানকার পরিবেশে আসলে সবাই ধূমপান করছেন সেই জায়গাগুলো পরিত্যাগ করাটা জরুরি। হয়তো ডক্টর খুব ইজিলি বলেছেন, বাট কাজটা অবশ্যই সহজ নয়, সেটাও তিনি উল্লেখ করেছেন। চাইলে কাউকে আসলে গামও ব্যবহার করার তিনি পরামর্শ দিয়েছেন। আমাদের বিষয়ে ফিরে যেতে চাই। স্যার, উই উইল গেট ব্যাক টু hypertension again. What is the benefit of hypertension control at the grassroots level, and how cost effective is it for Bangladesh?
High blood pressure control is one of the very most important things that primary healthcare doctors, nurses can do to protect patients' lives. It's really important. If you're taking care of a patient and you're not controlling their blood pressure, you're really not doing them a service. If I have a sore shoulder or a headache, I'm going to go to the doctor and they'll manage it, or the nurse. But if you have high blood pressure, you can't know it. It's silent. So a very good health provider will make sure to take your blood pressure accurately and to give you medications. Those medications are very effective, they're very safe, they're inexpensive, and they can save your life. Right now, in about a quarter of the country, the Bangladesh Hypertension Control Initiative is treating patients and has greatly increased the number of patients on treatment for both high blood pressure and diabetes, up to more than 4 lakh patients, more than 400,000 patients, many of them treated in community clinics as well as in the Upazila health complexes. In those programs, we've seen a huge improvement in outcomes, with most patients having their blood pressure controlled to a level of less than 140/90. There are 2 numbers in blood pressure, the top one and the bottom one, and we really want to see it below 140/90, but there are still crores of people in Bangladesh who are walking around without their blood pressure control. So in the community, getting convenient blood pressure medications is very, very important.
to have these, we need very good doctors and nurses as well, isn't it?
It's interesting, because hypertension control can be standardized, you can decentralize this to the community clinic. We've shown that with our partners here, that in fact, because it's a chronic disease where you have to take medicine every day, it's better to get care locally than to go to the big fancy place farther away. The number of people who have the right treatment in a small local clinic and stay on that treatment is higher than the number who go to a bigger facility. So having diagnosis and treatment available in the community is the key to treating blood pressure well, reducing the risk of heart attack and stroke, and improving not only life expectancy, but healthy life expectancy and productivity as well.
So you're mentioning, so if you want to control your high blood pressure, you don't need to spend so much money for that.
Absolutely. What we're seeing is that medicines for high blood pressure need not cost more than the equivalent of US $5 or $10 per year, 10,000 Dhaka per year for a patient. So it's quite affordable, and governments around the world purchase the medicines so that patients don't have to pay, because any payment will deter the patient from seeking care. So one of the things that's very positive about the health system here in Bangladesh is that treatment is free to the patient, but we need to make sure it's accessible also.
You have mentioned you have worked in New York City for so long. So what is the situation over there in hypertension situation?
In New York City and in the United States also, we should be doing better. If there's only one number that really summarizes how a country is doing, and that's what proportion of all people with high blood pressure are being well treated and have it under control. In the US, that's about 50%, 50. In Bangladesh, it's about 15%, 15. And in the best performing countries in the world, it's as high as 60%. And they could even go higher. So if we look at that one number, the proportion who are well treated among all who have it, I hope that Bangladesh will be able to double or triple the treatment success.
So you have been to so many countries, I assume. So which countries has the highest rate of hypertension?
Well, there are countries such as hypertension control, you mean?
Control.
There are countries like Costa Rica. Costa Rica has a very strong health system where there's a whole team, the doctor, the nurse, the outreach worker, access to social services, and there they're able to get most patients controlled because there's a sense of responsibility, mutual responsibility, that the health team is responsible for each family, and the family knows where they have access to care and where they can get services.
So they have very good communication then?
Very good teamwork and very good communication. That teamwork is very important because controlling good health care isn't just about a great doctor or a great hospital, it's about a great team. In fact, if you look at the US, the very best health systems, Kaiser, Mayo Clinic, work in a team. They have a whole concept that of course, there's a one-on-one relationship between a provider and a patient, but even more important is the team collaborating to make sure that the patient stays healthy and doesn't get a heart attack or a stroke that could kill them.
Thank you, sir. I have one more question for you. Access to medicine is often a barrier to hypertension control. How can we ensure individuals have access to quality medications?
Within the public sector around the world, we think it's very important that governments enter into multi-year contracts and that they independently validate the quality of the medications. What we've seen is that with that approach, the cost of medicines for high blood pressure is very low, not more than $5 or $10 per year per patient. That's very important.
You have mentioned earlier. So we will talk more about hypertension. Let's get back to something else. So
Sodium, maybe? We talk about prevention of hypertension, Taeeb.
Sure, sir. But we have a break. We will take a break. Before that, I would like to know, it's been 5th or 6th times maybe, or 4th times for you here in Bangladesh. How is Bangladesh for you so far?
It's always exciting to be here in Bangladesh and see the progress that's been made and the great potential for even more progress in the future.
How are the foods like? Have you tested? Because you've been to India, So but the food quality and the spice is very close to each other. So
I enjoy it.
you enjoy it.
I enjoy it.
But you don't try too much, I guess.
I enjoy it, and you know, this is something we'll talk about. You can have great food, and it can be healthy also.
Healthy also.
Vegetables, delicious. Fruit, delicious.
Yeah.
And having less salt.
Less salt. Yes, যেটা বলছিলেন উনি যে আসলে কম লবণযুক্ত খাবার খেতে হবে শরীর ভালো রাখতে হলে। আমরা অনেক বিষয়ে কথা বলছি। আরও একটা প্রশ্ন ডক্টর ফ্রিডেনের কাছে আমার রয়েছে। স্যার, we will have one more question before the break. Reducing sodium is so important in the fight against high blood pressure. What should we do here in Bangladesh to consume less salt, which you mentioned?
For an individual, there's certain things you can do. You can put less salt into your cooking. You can use low sodium salt, which is a healthier alternative.
All right.
When you buy food, you can buy food with less salt. But it's very hard for individuals to reduce their salt intake. Try, but it's hard. Governments can do a lot. Governments can make it much easier to know which products have too much salt. They can make it easier to purchase the healthier salt. They can work with companies to reduce the amount of salt in packaged foods. And they can make sure that if something is purchased by government or sold on government property, it complies with the government's standards for healthy food.
All right. But sir, if you put less salts while you're cooking, but what happened here in Bangladesh, when people start eating and they find it, you know, we don't have too much salt in the food, they start putting salts from the outside.
So there's a few things there. One is, if you use more spices, you need less salt. If you use more things like lemon, you need less salt. It tastes salty with a lower level of sodium. And actually what people add at the table is not usually the great amount of salt that's been added. It's really more what's used in cooking that may be invisible to you, but raising your blood pressure. Reducing sodium is the single most effective way to reduce blood pressure in the community.
So you're suggesting put lemon rather than using salt on your food. Thank you so much, sir. যেটা বলছিলেন যে আপনি যদি কম লবণযুক্ত খাবার খেতে চান সেক্ষেত্রে লেবুর ব্যবহারটা খাবারে অনেক উপকারী হতে পারে, যেটা ডক্টর ফ্রিডেন আমাদেরকে মাত্র জানিয়েছেন। We were talking about reducing salts in our daily food. What have you seen in other countries apart from Bangladesh?
First off, we have to say that the world is lagging in reducing sodium. 10 years ago, countries committed to reduce sodium by 30%. Not a single country has done that. I'm hopeful that Bangladesh could be the first and an absolute world leader. But there's a lot to learn from other countries. For example, Finland had a program where they required companies to put a warning label on dangerously high sodium products that quickly reduced sodium. If you look at Korea, in Korea they identified which products had the most sodium, and I call these culprit foods because they're the culprit, and then work specifically to reduce the sodium in those foods. In Korea, that was kimchi. Here in Bangladesh, maybe something else. You have to identify what the food is and then come up with an alternative that tastes just as good but doesn't give you high blood pressure. Also, if you think about the United Kingdom, they had a big reduction in sodium when they had a focused effort giving targets to companies and telling targets, you have to meet this target. They showed almost 20% reduction in sodium consumption, and that was associated with an almost 1/3 reduction in heart attacks and strokes. And then in the region, Sri Lanka has been successful reducing sodium, but not to the extent needed. Bangladesh has shown that it can be a world leader. If you look at health outcomes in child health, for example, Bangladesh does much better than countries with similar income levels. Now the challenge is no more primarily the infectious diseases. Now the challenge is things like high blood pressure, and it's one of the most preventable and treatable conditions. So with leadership and focus and involvement, as Bangladesh has applied so well in the health sector, Bangladesh could prevent hypertension, and for those who have it, treat it effectively.
Beautiful, sir. The planning or the advice you have tell us is, as a team we have to do it, but as an individual, if I feel like I don't want to consume sodium or salts anymore, what I have to do by myself?
First thing I would do is look at your home cooking. How much salt are you buying? Track that number. Are you using 1 kg every
So it's like
2
in
months?
a month.
Yeah. And so then maybe you can think, okay, what am I using it for? Can I just cut it by a third? Can I just reduce it by 1/3? And I'll put some chilies, or I'll put some lemon, or I'll put some other delicious spices in. You know, I say, great cooks use spices, sloppy cooks use salt.
বিউটিফুল স্যার যেটা বলছিলেন ডক্টর টম ফ্রিডেন যে আপনার সল্টের পরিমাণ খাবারে কমাতে হলে যদি পারিবারিকভাবে চিন্তা করেন সেক্ষেত্রে হয়তো পরিবারের যিনি কর্তা রয়েছেন বা যিনি রান্না করছেন একটা প্ল্যানিং অনুযায়ী মাসে যতটুক লবণ ব্যবহার হচ্ছে তার একটা কিছু পরিমাণ কমিয়ে 2/3 পরিমাণ কমিয়ে সেখানে হয়তো একটু মরিচ ব্যবহার করা যেতে পারে কিংবা লেবু ব্যবহার করা যেতে পারে খুবই গুরুত্বপূর্ণ তথ্য আমরা তার কাছ থেকে পাচ্ছি Sir, I have another question for you. Packaged foods are often high in sodium. What can be done to incentivize healthier options?
The best practice from around the world is a front-of-pack warning label that tells people this product is high in salt or high in calories or high in saturated fat, and then people can make a decision whether they want to have it or not. Also requiring mandatory companies to put that warning on incentivizes the companies to reduce the unhealthy food so it's healthier. So what you're doing is you're improving two things. You're improving both the options that consumers have and the choices that consumers make. Furthermore, there are low sodium salts on the market, and those are much healthier. So we say eat less salt, and what salt you do eat should be a low sodium salt.
Beautiful, sir. Can you reflect on the COVID-19 pandemic and the impacts between COVID-19 and hypertension?
COVID-19 showed us that any vulnerability increases the risk that we'll get very sick or die from a health threat, whether it's COVID or the next health threat. So if we want a more resilient population, we need people who have their hypertension controlled. Uncontrolled hypertension was a risk factor for severe illness or death during COVID. Controlling hypertension can save your life, prevent a stroke, prevent a heart attack, and make you more resilient and more likely to withstand whatever comes your way.
But does it have any connection with, your work stress or mental stress or the, relationship you're having with your close ones not going good? Does it have any connection with that?
There's kind of the concept that stress increases blood pressure, but that's not a very big effect, if any. It's more a question of just what biologically you have. As it happens, I have hypertension, just as many adults do. I eat almost no salt, I don't have stress, I have very healthy habits, but unfortunately I have high blood pressure. So I take the medicine for it. It's a generic medicine. It's the same one that's used in the community clinics here in Bangladesh. There's nothing second-rate about the treatment the government is offering. And I know that that drastically reduces my chance of having a heart attack or stroke or being severely ill if I do get COVID or another infection.
But isn't it tough to consume food without salts?
Not at all.
Is it a practice?
Not at all, actually. Once you get used to it, then salty food doesn't taste good. Okay. So it's a question of adjusting your tastes. And, I can have very spicy food. It has almost no salt, but it's still very spicy. It's very tasty. In fact, I find that consuming less salt, you can discriminate more. You can tell the different flavors apart better and really savor the food.
Do you think, doing yoga can help hypertension?
Yes, there is some evidence that certain forms of yoga, especially those that are aerobic, where you're getting exercise, can reduce the blood pressure. There are a variety of studies of this. Some show an impact, some don't. And my understanding of the scientific data is that those forms of yoga that involve a lot of movement, they're shown to reduce blood pressure in the same way that exercise can reduce blood pressure.
Sir, we're almost into the end of the show. I would like to know what's the future plan for Resolve to Save Life here in Bangladesh?
We partner with non-governmental organizations such as the National Heart Foundation of Bangladesh and others, and we work to support the government. We are encouraged by the really good start of the Bangladesh Hypertension Control Initiative. We hope this will cover the entire country and get a high rate of both effective treatment and finding the people with hypertension and putting them on treatment. That will prevent lakhs of heart attacks and strokes. And we also hope that Bangladesh might be the first country in the world to have a 30% reduction in sodium intake.
Oh, that's beautiful. You came yesterday, I guess, here in Bangladesh, here in Dhaka. So what's your plan rest of the days in Dhaka?
We'll have a series of meetings to understand the status of the hypertension control program and the prospects, the potential for sodium reduction. I would also say that Bangladesh has done an excellent job banning trans fat, which is a toxic product that was in the food, and now it's a question of making sure that the companies comply with the government regulation to get rid of this toxic artificial compound called trans fat.
Beautiful, sir. Sir, we have a very long show, but if I want to tell you that if you want to sum up the whole show in 3 sentences, how to reduce hypertension, what would that be?
Hypertension is the thing that is most likely to kill you and your loved ones. You can prevent it by reducing the amount of sodium you consume, and for everyone, you should know what your blood pressure is, and if it's elevated, take medications every day to keep your blood pressure less than 140/90.
Thank you so much, sir, for your time. Thank you.
Thank you, Taeeb. It's wonderful to speak with you.
It's wonderful as well. আমরা ডক্টর টম ফ্রিডেনের সাথে কথা বলছিলাম, যেমনটা তিনি বলেছেন যে ব্লাড প্রেশার কন্ট্রোলে রাখাটা খুবই জরুরি। যারা আমাদের এই শোটা দেখছেন, আমি আশা করব যে নিজেদের ব্লাড প্রেশার নিয়ে আপনারা রেগুলার এই ব্লাড প্রেশারের খোঁজ খবর রাখবেন এবং সুস্থ থাকবেন, ভালো থাকবেন। পূর্বাচল ভ্যালি যোগসূত্র এখানে শেষ করছি। শুভরাত্রি।